Good evening. Welcome to Supporting Our Sisters, Transforming Uterine Fibroid Awareness into Action. I'd like to thank the Congressional Caucus on Black Women and Girls for hosting this important event. I'm Linda Goler-Blount, President and CEO of the Black Women's Health Imperative. As many of us know, uterine fibroids are a significant health concern for women. It's estimated that 20 to 50% of women of reproductive age currently have uterine fibroids, and up to 77% of all women will develop fibroids before menopause. An estimated 80% of Black women develop uterine fibroids during their lifetimes, but sadly, too many go undiagnosed. Studies show that Black women are 2 to 3 times more likely to have fibroids, develop them at a younger age, encounter more severe symptoms, and are more likely to be treated with hysterectomies when compared to their white counterparts. Complications from uterine fibroids can lead to needless maternal deaths, maternal morbidity, and to infertility, an ongoing crisis, especially for Black women. We need research, clinical trials to understand the development and progression of uterine fibroids in Black women, to ensure we understand which therapeutics are most effective for Black women, and to develop new treatment modalities. We also need physicians to understand the risks that Black women face to shorten their journey between pain, heavy bleeding, and anemia to a definitive diagnosis and treatment. This evening, we will hear from policymakers committed to eliminating barriers to research and quality gynecologic care, physicians who treat women with uterine fibroids, patient advocates on the front lines of awareness building, and most importantly, patients themselves. I'm honored to welcome Congresswoman Yvette Clarke of New York and Robin Kelly of Illinois to this list of distinguished speakers and physicians, as well as the founders, presidents, and CEOs from the Society for Women's Health Research, the Fibroid Foundation, and the White Dress Project, all of whom are committed to uterine fibroid awareness and the development of effective therapeutics. As the representative of the 9th Congressional District of New York, Congresswoman Clarke is building her legacy by introducing landmark legislation for her constituents and the nation as a whole. She is one of the co-chairs of the Congressional Caucus on Black Women and Girls, which develops programs to support the health, wellness, and aspirations of Black women of all ages. Congresswoman Clarke introduced, and the Black Women's Health Imperative proudly supports H.R. 2007, the Stephanie Tubbs Jones Uterine Fibroid Research and Education Act of 2021. This legislation will provide funding to increase research and education, reduce racial disparities, and ensure women get the information and access they need to receive effective treatment for their uterine fibroids. Congresswoman Clarke and Congresswoman Kelly, thank you for your leadership on this issue, and thank you for being such unwavering supporters of Black women and of the Black Women's Health Imperative. The floor is yours, Congresswoman Clarke.
Let me start by thanking you, Linda, for all of your hard work, leadership, and advocacy for Black women's health. We truly appreciate the work that you continue to do in pressing policymakers to do what needs to be done to center the lives of Black women and girls in health and the imperatives that we face as vulnerable populations. Good evening, everyone, and greetings. I'm Congresswoman Yvette D. Clarke, and I proudly represent New York's 9th District, Central and South Brooklyn. I'd first like to welcome each of you to the Black Women and Girls Caucus event, Supporting Our Sisters, Transforming Uterine Fibroid Awareness into Action. I'd like to acknowledge our co-chairs for the Congressional Caucus on Black Women and Girls, Congresswoman Robin Kelly of Illinois, and Congresswoman Bonnie Watson Coleman of New Jersey. Congresswoman Kelly will be bringing us greetings shortly. Today, I am proud to share the screen with women who get it. They know that we need to join together and amplify our voices for increased awareness and funding for the research and treatment of uterine fibroids. For those who don't know, uterine fibroids are non-cancerous growths on the uterus and are one of the country's most common gynecological conditions. Increasing awareness about uterine fibroids is critical to our efforts to address the national maternal mortality crisis and prevent pregnancy-related deaths. About 26 million women and girls in the United States between the ages of 15 and 50 have fibroids. Of the 26 million, no group suffers more from fibroids than Black women. Black women are at increased risk for the disease compared to white women and tend to get fibroids at a younger age. And also suffer more severe symptoms. Fibroids are estimated to cost the healthcare system $5.9 billion to $34.4 billion annually. However, the exact number of affected women is unknown because it's difficult for healthcare providers to detect and accurately diagnose this condition. This issue is not received the attention or funding that it deserves. And that is why I'm proud to introduce H.R. 2007, the Stephanie Tubbs Jones Uterine Fibroid Research and Education Act of 2021, named in honor of the late Congresswoman Stephanie Tubbs Jones of Ohio, the original sponsor of this legislation, who's also the first Black woman to chair the Committee on Ethics. During today's event, we will hear from our distinguished panel of advocates and providers, Ms. Tambra Cherie, Ms. Cynthia Bailey, who have shared their stories by utilizing their platforms on the Real Housewives of Atlanta and the Bell Collective, respectively. Ms. Sateria Venable, a patient advocate that founded the Fibroid Foundation, and Doctors Rochelle Villanueva and Erica Marsh and Jessica Shepard, who practice what they preach and understand the racial disparity issue that is impacting our community. Before we hear from my panel, I'd like to turn it over to my sister in service, Congresswoman Robin Kelly of Illinois, chairwoman of the Congressional Black Caucus Health Brain Trust. Congresswoman Kelly, the floor is yours.
Thank you so much, my colleague. Good evening, everyone, and thank you all for joining us today for this very important discussion. I'm so glad that we're having this conversation today because for too long, women and specifically women of color have been left out of the discussion about our own health care, especially when it comes to our reproductive health and wellness. No one knows about our own experiences more than us. So I'm glad that you have all joined us today to bring attention to this condition, which affects, as you have heard, an estimated 26 million individuals in the United States. Despite the large number of women suffering from uterine fibroids, diagnosis and treatment is still often difficult, and we need to do more research to expand what we know about uterine fibroids to better treat the people suffering from them. This research is especially important to African American women because compared to other racial groups, our risk of developing uterine fibroids is 3 times greater than our peers. Additionally, Black women often have fibroids at younger ages, as my colleague said, and we are likely to have more or larger fibroids, which can come with some very severe symptoms. Because discussion of reproductive health care has been taboo for so long, many women may not realize the symptoms they are experiencing could be caused by fibroids, or that there are treatment options available to them. As you may know, my beautiful friend and colleague, Congresswoman Yvette Clarke, who is, of course, our host today, has introduced the Stephanie Tubbs Jones Uterine Fibroid Research and Education Act. This bill is necessary to establish funding to increase research and awareness of uterine fibroids and to improve access to health care for the 26 million women suffering, and I'm happy to support her. As we begin expanding our understanding and improving our treatment of this condition, we have an opportunity to make progress in health equity. Congresswoman Clark's bill is a necessary step in ensuring that all healthcare providers are aware of the elevated risks for women of color and are communicating these risks and treatment options to their patients. This bill will also empower more women with awareness and knowledge of this condition so they can better advocate for themselves in healthcare settings and conversations with their providers. I'm looking forward to hearing from our expert panelists today, and I want to thank our panelists for sharing their expertise and experiences. I especially want to thank our panelists who will be sharing their own stories. That's not always easy sometimes. Reproductive health issues are very personal, and I want to commend the bravery of the women speaking today, because sharing your own experiences is so important in dismantling the discomfort around discussing this serious healthcare concern. So thank you once again, and I will turn things back over to our host, my colleague, Congresswoman Yvette Clarke of the People's Republic of Brooklyn. Thank you.
Let me thank you, my sister colleague, Congresswoman Kelly, for your leadership in blazing a trail for healthcare outcomes that will be positive for our community. You have been extraordinary in your leadership, and I'm so glad to be in the trenches with you as we move forward to pass the Stephanie Tubbs Jones Act. Next, I'd like to introduce a very distinguished woman. She is the president of the illustrious sorority, Delta Sigma Theta Sorority Incorporated, my soror, and President Beverly Smith.
Thank you, Representative Clarke, and I guess I'll have to say Soror Clarke, for the introduction and for the opportunity to be here. I first have to thank you and Representative Robin Kelly for bringing this forward, and particularly Soror Clarke, you, the Stephanie Tubbs Jones Act. Stephanie Tubbs Jones was also a member of Delta Sigma Theta, and I am extremely proud to be able to represent and speak not only for Delta Sigma Theta, but for women of color in general. Now, I'm not a medical professional, I'm not a congressional leader, but what I can say is that I do represent 350,000 members of our organization and our 1,058 chapters worldwide in terms of our interest and concern about this issue. As a member of the Divine Nine, and I know that's a popular term these days, D9 and the 4 sororities that we have that we represent over 2.5 million women who are struggling and suffer with this issue. We have in Delta Sigma Theta resolutions on issues that are important to us. And when I went back and looked at when we first made this resolution, I realized it was in 2015. 16 years ago, this issue was a concern for us. I had fibroids when I had my son at 45 and had to stay in bed for the last 6 months of my pregnancy. So I know this issue has been around a very long time. In our effort to make sure that we made a difference and put a resolution forth that would go to Congress, we did. And I'll read a part of the resolution. Now, I'm not going to read any whereases, so you don't have to worry about that. You've heard and you will hear more about what those whereases say in terms of the distinctions and the issues and the statistics around that. But speaking for Black women who have this issue, and speaking for all who suffer from this issue, Delta Sigma Theta Sorority resolved to call upon other organizations in African American healthcare community to conduct similar campaigns and education on the options for quality outcomes for fibroid issues. And I believe that all of us have come together as Greek letter organizations to do this and to support it. But we finally resolve as an organization, and speaking to all of us as Black Greek letter women, we call upon lawmakers at every level of government to fully fund programs to research and propose holistic and community-based education training programs and prevention efforts for this strong and important reproductive health issue. As we move forward tonight, I urge all of you who are listening to pay attention to what you hear. to focus on the concerns that are there, to understand the stories that others have to tell, and join us in the move to make sure this legislation moves forward. Thank you for the opportunity, Representative Clark.
And I thank you, SORA President Beverly Smith, for your leadership and speaking on behalf of so many whose voices go unheard. We appreciate you and your leadership.
Thank you.
Last Congress, I shared my personal story at a Black Women and Girls Caucus event and felt a wave of support from other women who shared their stories with me. Sharing your personal story in life will surely help others who share your experience or our differing experience that helps normalize this conversation and spread awareness, especially on the issue of uterine fibroids. Next, I'd like to introduce Tambra Cherie, radio personality in Jackson, Mississippi on 97.7 WRBJ FM and TV personality on the OWN Network's hit show, The Bell Collective.
Hi, thank you so much for having me. I definitely appreciate the opportunity to really come and talk to you guys just pretty much about my story that I've dealt with fibroids since I was in my 20s, to be honest. And I applaud all of the organizations that now that I see that we have help, because I felt like when I went through this, I will be so honest with everyone. I did not know what a fibroid was. I'm just going to be honest. No one talked to me about it. I didn't have a clue. And sometimes I do feel like my story is a little different, because I will be honest, the very first time I had a surgery, my surgery was emergency surgery. The very first time I found out that I had a fibroid, and it was huge. 2 days before I had that surgery, I was in Miami on a beach in a swimsuit. I remember it like it was yesterday. I was coming back on a plane. I felt like a sharp pain in my side. That's the only symptom that I had. I didn't have, and we're talking quite frankly to women, I did not have heavy bleeding. I did not have the pain. I didn't. The very first time I made it to work, got off a plane, went to work, I had another sharp pain. The next time, the pain was unbearable. Literally went to the emergency room, and they were not even calling it a fibroid. They were calling it a mass, that I had to have emergency surgery because of mass. So when they finally did the surgery, it was a huge fibroid the size of a cantaloupe. And they had no clue how I did not have any pain whatsoever. I never had a lot of symptoms that I hear women go through. And I remember asking my doctor, I remember saying, how do we not admit this? Because to me, you get pap smears. Well, they said, well, maybe if you would have asked for ultrasound, we could have caught this. Who goes to the doctor and asks for ultrasound? I never knew that as a patient. Who asks for an ultrasound when you have no problems whatsoever? And I know now, because I've gone through it before. So of course I do, and I have another doctor, by the way, but of course I do ask about ultrasounds because I want to stay on top of it. And that's something that I've been doing. And I'm one of those people that I tell people I changed my diet afterwards. I completely eliminated dairy. I haven't had red meat. I stopped eating meat. I did everything. Stopped eating sweets. I was only eating vegetables. I love seafood. I even cut seafood out because I started doing research myself. I started doing the research, did everything right, and they still came back. So I am all about the research because they still came back, and I did herbs. Now, do I feel like that in my case, that they helped slow down? I do feel that way. I do feel that. Do I also feel like that maybe I did have some to die off? I feel like certain things may help, but that's a part of doing research, the research that needs to be done. So yes, the next time I had a much less invasive surgery, much less invasive. But now we fast forward to Bell Collective, I still deal with fibroids. When I did go to the doctor, I found out I had 4 more fibroids that had come back. And I still tell women, I still don't have pain. I still don't have heavy periods. So that's a lot of research because I don't have the symptoms that I hear so many women go through. And right now, even from now to now, I've learned from the time that what you saw on Bell Collective. And that's one thing, when you're on the television, you have so many women and reach out to you and share their stories. Doctors reach out to you with techniques that you have never heard of. But even learning now, I learned that I even had more than 4 fibroids. But I still don't have those symptoms that I hear other women talk about. And that's even more scary because they can go unnoticed until you actually have a serious, serious, serious problem where I had to be rushed into emergency surgery. So that's kind of my story, just sharing how much research is really needed for this.
Let me take this moment to thank you, Tambra, because, the manifestation of uterine fibroids it is as very specific to the individual who is carrying the fibroid. And while we find commonalities, it's important to know, and for particularly our young girls as they grow up, that this research is needed because, as Tambra says, she doesn't fit the mold. And that means that any one of us can be carrying fibroids at any given time, and that is not healthy, and we must address it. So thank you for sharing your story with us. Now we will have Ms. Cynthia Bailey, international model, businesswoman, and star of The Real Housewives of Atlanta, who will share her experience with uterine fibroids with us today. Cynthia.
Hi, ladies. Hi, Congresswoman Clark. I'm so excited to be here with you guys today. While I was listening to Tamra's story, and I was just blown away that she literally didn't have that many symptoms. And I felt like I had every symptom of uterine fibroids. I had the heavy bleeding. I was anemic. I had low energy. I had a low sex drive. I mean, it really had pretty much taken over my life. And going back to what Tamra was saying, as someone on television, as a reality star, it got to the point where it really started to affect my quality of life, me being able to go to work. I felt like that was maybe 1 week out of the month where I actually felt good. The other 2, I was either bleeding or, recovering from bleeding, and just trying to be, upbeat and healthy. I think one of the most important things that I've done on the show, I use on my platform, is to actually talk about fibroids. I had never heard of a fibroid either until I actually was pregnant with my daughter, Noelle. And from that moment on, it started small and it just grew over the years and became a problem over the years. At the time when I talked to my producers about talking about including my fibroid story in my storyline, I remember them saying to me that, I don't think the audience will really get into that they will care about that. And they were highly mistaken, because I actually ended up really fighting to have a scene where I was talking about that to my now ex-husband. And it was such a powerful scene because I cannot tell you, I've been on the show for over a decade now. And I think me having that conversation and going through my process of having my fibroids removed, I had UFE, uterine fibroid embolization, done. And I think just sharing that process with the world and making people feel like they could actually, that it was okay to actually talk about it, because a lot of women were embarrassed about fibroids and embarrassed to even talk to their partners about it. And I really included my husband at the time in my journey, because it didn't just affect me, it affected him, it affected my child, it affected everything in my life. And I will say, me sharing my story on national television was probably the most important, one of the biggest things that I've ever done. And the response has been incredible. Everywhere I go in the world, women are coming up to me, thanking me for having this conversation, because it made them feel comfortable having the conversation. Like, I literally call myself the fibroid lady now, because everywhere I go, and we do a lot on the show. They're like, oh my God, I have fibroids. I had my fibroids removed because of you. I felt comfortable talking about my fibroids with my husband, because a lot of women were so embarrassed they didn't even tell their husband. They were silently suffering and dealing with it every month. So this Uterine Fibroid Research and Education Act is so very important because we have to keep this conversation going. I recently just had one of my bosses in New York actually reach out to me who is suffering with fibroids, and she wanted to know all this information, and I told her about my doctor and what her options were. I really find that as much information that's out there, there's still not, women still don't have a lot of education when it comes to how to deal with their own individual fibroids, because to your point, Congressman Clark, it's all individual. Everyone's journey is kind of different. So I am very honored to sit with you ladies today to push this forward so that we can actually, make some things happen, because I feel like I'm still having the same conversation that I was having 6-7 years ago when I actually talked about it on the show. So that proves to me that it has not moved fast enough in terms of the progress that's needed to be able to help other women deal with this, what I actually consider an epidemic among women, especially Black women.
Well, thank you for sharing your journey with us, Cynthia. It means a lot for all of us to hear from those who are prominent in spaces that we don't find ourselves in, and that can lend their voices. So to both you and Tambra, thank you so much. It will mean a lot to women across this nation and, quite frankly, globally. Now we will hear from 4 amazing women who also have worked in the uterine fibroid space. And I will turn it over to our illustrious moderator, Linda.
Well, thank you, Congresswoman Clark, so much. And thank you to Beverly Smith and Tambra Cherie. And thank you to Cynthia Bailey for being the fibroid lady. We do need to talk about fibroids, talk about them openly, and talk about the need for research. And the thing that I think you would all agree with me on is it is time to stop suffering in silence.
Amen.
So I so appreciate your sharing your experiences with us. So as the Congresswoman said, it's now my pleasure to introduce our next round of speakers. And our first speaker is Dr. Rachel Villanueva. She is a board-certified obstetrician and gynecologist with the New York University Langone Medical Center. She's a women's health expert and advocate, and she is all things women's health. Currently, Dr. Villanueva is the president-elect of the National Medical Association, which is the largest and oldest national organization representing Black physicians and their patients in the US. The NMA is a leading force for parity and justice in medicine and the elimination of disparities in health. Dr. Villanueva will discuss racial disparities and uterine fibroids. Thank you. Dr. Villanueva, the screen is yours.
Thank you, Linda, and good evening. On behalf of the National Medical Association, we are so grateful to Representative Clark for the invitation to participate in the discussion of this very important women's health issue. It's an honor to share this platform and with Representative Clark and all of these tremendous women today. I wish you could see the back room here. I mean, the screen is just so impressive. And I'm right under Cynthia Bailey, which is ridiculous. But the COVID-19 pandemic has certainly served to highlight for all of us the racial inequities that exist in our society, and none more important than those in our healthcare system. Structural racism, systemic and pervasive bias have all been implicated in disparate outcomes for communities of color. Born of this racist system that didn't allow Black physicians to participate in medical organizations or in hospitals, the NMA has remained committed to its first organizational priority, which was to eliminate healthcare disparities. We not only represent thousands of Black physicians across the country, but their patients who are largely the underserved. As president-elect and a practicing obstetrician gynecologist, I am absolutely thrilled to be able to address this area in Black women's health that's been gone, that has not been addressed for so long. You've heard these statistics many times tonight, but I'm going to repeat some of them because they're so important for us to remember why we need to have attention and resources addressed to this issue. While fibroids are benign and for most women asymptomatic, our community does not have that same luxury. Our statistics are actually staggering. It's a disproportionate burden for Black women, and it affects us 3 times more likely than white women. We tend to be diagnosed earlier. We're diagnosed with more severe disease, more number of fibroids, and the size of our fibroids tend to be larger. We seek treatment later, and with that treatment, we are often given more surgical management options and less often given minimally invasive options that Tambra was alluding to for her second surgery. These disparities in incidence and treatment are important, particularly in the reproductive years for our fertility and reproductive options. For too long, we have suffered in silence. I'm often heartbroken in my office when I hear the fear and pain and despair that women will come in talking about their issues with fibroids. Tambra's and Cynthia's impactful stories underscore that it's not only physical issues that we deal with fibroids, but psychosocial issues. And disparities exist in those issues, that realm as well. Researchers who you'll actually hear from tonight, Dr. Marsh, have found that Black women more likely report severe symptoms that interfere with their basic quality of life, their ability to go to work, their ability to have relationships, and even their self-esteem. And we know that structural racism and bias by healthcare providers can impact a woman's ability to even want to see the doctor and seek treatment. And while we recognize that Black women are affected in greater number, there's a scarcity of data and research and little understanding of why. And in science, data drives knowledge and treatment and solutions. So we need to get that data, and that's where the research comes in. While there's evidence that there may be genetic and social and nutritional and environmental factors that make Black women more at risk for fibroids, there is little data for these causal relationships. At the NMA, we recognize the need for increased research in communities of color, diversification of who participates in these clinical trials, even diversification in who investigates and what we investigate. And this is one of our organizational priorities. Black women are vastly underrepresented in research and in clinical trials. And we know that one size does not fit all. We need data specific to Black women. The pending legislation introduced by Representative Clark will not only explore the racial gaps in care, but funding for more research will allow for improved understanding, awareness, and treatment. The National Medical Association is as committed now to the elimination of disparities as when it was created in 125 years ago. Our OBGYN section is made up of African American physicians who are culturally sensitive and keenly aware of the diseases that impact our communities disproportionately. We are so proud to support the Stephanie Tubbs Jones Research and Education Act, and we look forward to continuing to partner with Congresswoman Clark, with the advocates and experts on this panel today, to fight to reduce racial disparities and barriers to access, to educate and empower women regarding options, to expand research and champion health equity to improve health outcomes for those women who suffer from fibroids. The issue of fibroids in Black women should have long ago been considered a public health issue for everyone. Thank you so much for this opportunity.
Thank you, Dr. Villanueva. You touched on so many very important points, but I just want to echo about this need for research. You talked about research and data driving solutions. They also drive coverage as well. So we need more data, we need research to uncover the kinds of therapeutics that need to be covered so that Black women don't get diagnosed so late or lack access to care. So thank you so much. Next, we'll hear from someone, one of those people on the front lines, Sateria Venable, founder of the Fibroid Foundation. The Fibroid Foundation is the premier global community of fibroid patients, and its mission is to be the voice of women living with fibroids, to support initiatives to find cures, and to advocate for funding of patient-centered research. Now there's a thought, research that's actually centered around patients. Sateria will discuss how a patient can become an advocate, and how a patient became an advocate, and how one person's crisis became a movement. Thank you, Sateria.
Thank you, Linda, for having me. Good evening, everyone. It's an absolute pleasure to be here. I'm Sateria Venable, founder of the Fibroid Foundation, and I'll just kind of start by sharing my personal story, which led me here. Fibroids affect us all so deeply. With diagnoses in the millions, we probably all know someone struggling with uterine fibroids. So I thought I'd start today by sharing the story behind the Fibroid Foundation. The Fibroid Foundation was really born out of frustration in 2007. I was grappling with heavy menstrual bleeding and other troublesome fibroid symptoms. I had just had my second of what sadly would be 4 fibroid surgeries, and I couldn't understand why it was so difficult to find a fibroid specialist in a major city. I happened to be living in Chicago at the time. I also was disheartened by the fact that in less than a year following each of my surgeries, I was faced with debilitating symptoms and potentially facing yet another procedure. When I researched the statistics, I wondered why everyone wasn't screaming from the rooftops. NIH data documents several startling data points. I'll highlight 4 of them. By the age of 50, as many have mentioned before, 80% of Black women and nearly 70% of white women will have fibroids. New studies are showing significantly increased risk of cardiovascular disease associated with hysterectomy, which sadly is still the most frequently administered fibroid treatment. Data revealed that hysterectomy, with conservation of both ovaries, women can expect a 13% increased risk of hypertension, a 14% increased risk of hyperlipidemia, a 7% increased risk of cardiac arrhythmias, an 8% increased risk of obesity, and a 33% increased risk of coronary artery disease. Fibroid symptoms can also significantly impact quality of life. In a recent quality of life study, women reported heavy menstrual bleeding, bulk symptoms, and adverse birth outcomes, which have a severe impact on a patient's day-to-day activities, as well as emotional and psychological well-being, which often goes unaddressed. And then there are the healthcare costs and the treatment disparities, which are a significant barrier to treatment. Today, the Fibroid Foundation is a community of 29,000 with 25 chapters, 22 of which are in the United States. We're based in the Washington, D.C. metro area. Common themes that we hear from our community are painful symptoms, fear of treatment, and limited access to minimally invasive treatment options and fibroid specialists. I'd be remiss if I did not mention the unique challenges faced by fibroids patients during the pandemic. Imagine hemorrhaging at home and having surgeries postponed due to COVID. That happened to many of our members. And then there are those beautiful moments that we experience with our advocacy efforts, like when we help someone find a fibroid specialist, when we provide post-op guidance that only a patient can provide, when we help to design research studies that are uniquely sensitive to patient needs and concerns, or as recently host a summit that is viewed in over 90 countries. And it's beautiful to see that although we face significant physical stresses, the strength of our community endures. Women go to work every day in severe pain, as I did. Imagine how much more we could thrive if we weren't in agony. Sometimes when I share our mission with people, I get a blank look. That is until I encourage them to ask the women in their lives about fibroids. Then it becomes personal. Then there's a connection. This experience, along with our advocacy efforts on Capitol Hill, led me to wonder how we can all recognize that connection that we all have to a health concern that affects most women. This was the origin of our recently launched Ask Her campaign. Ask Her is an invitation to understanding. It's an invitation to community. It's an invitation to caring. And lastly, it's an invitation to action. As we move forward with the fibroid bill, action is required of us all. I can see the finish line if we only engage one another to help those of us who struggle with fibroids. I'd like to close by thanking Congresswoman Yvette Clarke, Congresswoman Robin Kelly, and Congresswoman Bonnie Watson Coleman and the Congressional Caucus on Black Women and Girls for their beautiful leadership. Our organization looks forward to working with you toward the successful passage of the Stephanie Tubbs Jones Uterine Fibroid Research and Education Act of 2021 into law. Thank you all and be well.
Thank you so much, Sateria. I think you raised some interesting points that most of us haven't really considered, that fibroids aren't just a gynecologic issue, they are a systems issue, and all of our bodies can be impacted adversely by them. So thank you for that. And now we'll hear from two more physicians on the front lines. Dr. Erica Marsh is an associate professor of obstetrics and gynecology at the University of Michigan Medical School and the chief of the Division of Reproductive Endocrinology and Infertility. She is a committed community advocate and founder and director of the Onward Collaborative, a group dedicated to women's health and reproductive disparities research, education, and advocacy. In this capacity, she leads several large research studies. Dr. Marsh will discuss racial disparities and fibroids and the need for research and for improved education around fibroids, menstrual health, and reproductive health. And Dr. Marsh, as you are coming on, I have just one thing to say to you: go blue.
You would think after 12 months that I would remember to unmute myself, but I still need reminding. So thank you so much, Linda. Go blue to you. Thank you, Representative Clarke and Kelly, for your kind invitation to be here today. Thank you, Representative Clarke, for your advocacy on behalf of women and for moving forward the Stephanie Tubbs Jones Act. We need you, and we need the act, we need the funding, and we need the research and education that will come with it. So thank you. I'm going to claim the success from that for that act now, and I've already started visioning all the good things that will come from it. One of the goals of this event, from my perspective, is for everybody who watches this event to go out and be able to be a fibroid advocate, to be fibroid knowledgeable, to be fibroid informed. We've heard so much about these tumors, but just want to iterate, just want to make sure we're all on the same page. These are benign, meaning non-cancerous tumors of the wall of the uterus. They can be microscopic, so you need a microscope to see them, or they can be the size of a cantaloupe, as we've heard today, or even larger. The medical term for these tumors is leiomyoma, meaning smooth muscle tumors, because they originate from the smooth muscle in the wall of the uterus. But the more common name for them, fibroids, comes from the fact that they're composed of these irregular bundles of cells in an extensive connective tissue or fibrous matrix. We've already heard, again, that they account for up to $34 billion in cost annually in the United States, and despite being a benign non-cancerous disease, continue to be the leading cause of hysterectomy in the United States, which is ridiculous. Now, the only good thing about fibroids is that they don't present clinically in everybody that has them, and in fact, only 30 to 50% of women with fibroids present with symptoms, meaning most women with fibroids never have symptoms from them. And if the fibroid is not bothering you, you don't need to bother the fibroid. But unfortunately, for that 30 to 50% of women who do develop symptoms from those fibroids, most of those women develop multiple symptoms, which can include, as we've heard today, abnormal uterine bleeding, specifically heavy menstrual bleeding. It can include pelvic pain. It can include pressure symptoms or bulk symptoms, meaning everything from constipation, lower back pain, pressure on the bladder that leads to frequent urination. Fibroids can be associated with infertility as well. And then individuals who experience recurrent pregnancy loss, fibroids can be implicated in that. So, who gets fibroids? As we've heard, anybody with a uterus is fair game and in fact is likely to develop fibroids. This is a disease that disproportionately impacts Black women without question, but make no mistake, this is a disease of all women. Anybody who has a uterus is fair game. And so any research we do on any group, including research on Black women, is going to benefit all women. Why do we need specific research on African American women or women of African ancestry? It's because, as we've heard multiple times today, that ancestry is a risk factor for fibroids. There are also other risk factors, including obesity, hypertension, but race and age are the two most significant risk factors for developing fibroids. And we know that some studies have shown up to 89% of women of African descent will have a fibroid. So almost 90% of us will have fibroids by the time we're 50, which makes the question not who's going to get fibroids, but who's not going to get fibroids? Who is the 1 in 10 of us who actually won't have fibroids? Because 9 out of 10 of us are going to have fibroids. Now, we may not all have symptoms from them, but it's likely that 4 to 5 of us of that 9 are going to have symptoms and are going to need to seek care. So when do we get fibroids? We know that fibroids present much younger in women of African ancestry than they do in women of European ancestry. In a study that looked at women between 18 to 30, so these are not tumors. We may think of them as tumors that present in the mid 30s, 40s, mid 40s. In African American women and women of African ancestry, they present in our 20s. In a group of asymptomatic young women, when we looked at white and Black women, about 26, 27% of Black women had fibroids between the ages of 18 and 30, whereas only 6 to 7% of white women had them that early in life. So again, when more than a quarter of us have them before we even know we have them, and before, by the time we turn 30, you can imagine what those tumors look like over time. Now, there's been, some research funded on the pathophysiology of fibroids, meaning how the tumors develop. And that research is important, but we need to continue that and expand it to, as Sateria mentioned, to include more research on outcomes, more research on education, more research that is patient-centered or human-centered, and more engagement and outreach in the community. And that's important because we know that patient preference matters, and we know that patient-centeredness matters. That's not just a buzzword. It is one of the pillars of healthcare system quality, as identified by what was the Institute of Medicine, which is now the National Academy of Medicine, years ago in its report, Crossing the Quality Chasm. We know that patient-centeredness matters. And what do we mean by that? We're talking about essentially, to use the common quote, the right care in the right way at the right time, or even shorter, the quote, nothing about me without me. So whereas providers, we may listen for things like symptoms, age, are you finished childbearing, how big are your fibroids, where are they? The patient perspective is trumps everything, because at the end of the day, if a patient wants to keep their uterus, then we have to work around that, not the other way around. And historically, the power has been taken away from women, and women have been told to get hysterectomies. They've been told that that's the only treatment option for them. And don't get me wrong, I'm not anti-hysterectomy. I think hysterectomies for many women are the right choice, but we have to make sure that women are informed and empowered to make the choice, that they know their treatment options, and that they know their options include things other than surgery, and it includes options like that were shared earlier, including uterine artery embolization, so radiological options, and also medical options, a list of which is expanding regularly. We also want to make sure that we are respecting the fact that we don't want women to be discouraged in seeking treatment. We don't want patients to feel like their symptoms are belittled, and we don't want them to feel like they didn't have a discussion of treatment options. In terms of just quickly commenting on research, what does the research need to address? It needs to address the emotional and psychosocial impact of these tumors, as well as the pathophysiology of the tumors. Research has been done that showed almost 100% of women who have fibroids reported some level of psychological distress, and about 50% reported helplessness, and a little over 20% reported feeling a lack of support, feeling depressed, feeling inadequate. We also have learned in research that we've done that women experience an altered state of normal. Women think that when they bleed 30 days in a row, that's just a normal period, because that's the period my mom had, that's the period my sisters had. So I don't need to report that to the doctor when I'm asked, are your periods normal? I just say, yes, my periods are normal, because isn't a 30-day period normal? And the reality is, no, it is not normal. And if you're having that, you need to let your doctor know right now. In fact, if you're having a period half that long, you need to let your doctor know now. So that's where the education piece of this act is critically important, letting women, helping women understand what is normal for them, what level of pain is normal for them, and what is not normal. It is not normal or acceptable for us to be living in pain. Knowledge about fibroids is essential, and women have to be able to not continue to live in this very closeted space that they feel that they have to live in, and not talk about a issue that is as prevalent as this is. We know the reality is that if that 90% of men had fibroids, this would have been cured a long time ago. So just to keep it real. So we need to address this. We need to get the funding to impact, to work in communities, to focus on education, to focus on outreach, to focus on the full spectrum of research, not just pathophysiological, but patient-centeredness, patient outcomes, human-centeredness, and be the change that we want.
Well, thank you for that, Dr. Marsh. There's so much there, and you just highlighted the need for this very conversation tonight. Thank you. Next, I'd like to bring on another physician who, again, is on the front lines and using her voice in a very public way to continue this discussion on disparities in uterine fibroid tumors, as well as surgical options. I'd like to bring on Dr. Jessica Shepard, an OBGYN and the founder of Her Viewpoint, an online women's health forum, and that focuses on conversations that we don't always have every day and addressing taboo topics, but in a comfortable setting. Dr. Shepherd practices at the University of Illinois at Chicago and also serves as the director of minimally invasive gynecology. Dr. Shepherd will discuss health disparities in fibroids as well as the surgical options and outcomes. Dr. Shepherd?
Yeah, I'm going to let Cynthia, you want to go?
Okay.
I didn't want to just disappear. I just wanted to thank you guys again for having me and just actually say goodbye. I actually have to jump off and take another.
Thank you so much.
So this is amazing. Again, thank you. And let's keep the conversation going and make some things happen. I appreciate all of you. Thank you.
Thank you, Cynthia. Dr. Shepherd. So is Dr. Shepherd having some audio issues? Okay. We can come back to Dr. Shepherd? Okay. Why don't we, while we were fixing Dr. Shepherd's audio issues, let's go to our next speaker and we will come back because we certainly want to hear from her. I'd like to bring into this discussion someone who is also thinking a lot about research, and that's Catherine Schubert, Katie, who's the president and CEO of the Society for Women's Health Research, a national nonprofit dedicated to improving women's health through science, policy, and education. SWHR is also a thought leader on research in biological sex differences and in health and disease. I remember the early days in discussions about the importance of including women in clinical research, and someone from the society made a very important observation about research and how we need to include women. And she said, women are not female versions of men. We need our own research. So Kate, the screen is yours.
Thanks, Linda. Thank you so much, everyone. And on behalf of the Society for Women's Health Research, we're proud and thrilled to endorse the Stephanie Tubbs Jones Uterine Fibroids Research and Education Act. And as Linda just mentioned, SWHR was founded back in 1990 to promote research on biological sex differences and to improve women's health through science, policy, and education. And our work over the years is largely rooted in advocating for the inclusion of women and minorities in research that's across the lifespan and throughout the healthcare continuum. And without research populations that reflect treatment populations, health disparities and gaps in knowledge will only persist. So you all have heard a lot tonight about why we need additional research in uterine fibroids, why education and awareness is so critical in the area of women's health, but importantly, the disproportionate impact on Black women. And we're really just excited to continue to support the efforts of Congresswoman Clark and the Black Women and Girls Caucus and all of the organizations present here today to further this work, to raise awareness, to empower patients in their care. And we're hoping to do this through our convening of interdisciplinary roundtables. We have an upcoming paper on uterine fibroids that came from a roundtable back in the fall that a lot of folks here tonight participated in. We're very grateful for that. But we're also working on a uterine fibroids patient toolkit that will be coming later this year that's incorporating a lot of these ideas and ideas from folks here about how we can ask those questions, talk about uterine fibroids, talk to your family, your friends, your support system partners, et cetera. What we really need, though, I think tonight is everyone's support and action. So please, please, please call your representatives, ask them to co-sponsor HR 2007, tell them why this legislation is so critical and important and that it needs to be passed. We are so close, the energy is palpable. And I know, with your voices, we can make a difference, and this bill can get even further to amplify this message that this is a critical public health need and it needs to be addressed. So thank you.
Thank you, Katie. I think we are still working on Dr. Shepherd.
I'm here.
Oh, she's here. Yay. Okay, Dr. Shepherd, we certainly want to hear from you. I'm so glad your audio's back.
I know, me too. It literally was as Cynthia was exiting, mine started to not want to work either. But I'm so excited to be here and part of this wonderful panel that is bringing together a group of physicians and advocates and patients and organizations who are really doing the work that we need to do in order to educate, to push for legislation, exactly why we're here. And thank you, Congresswoman Clark, for having us here to discuss these very important topics. One of the, the key takeaways that I took from today, as a physician, yes, I know everything about fibroids. I see it every day in my practice and do so many surgeries for women who have come to me, whether it's referred or they come through second opinion, and really trying to hear their story and what they're trying to accomplish and hearing their struggles and trying to decrease the symptoms that they're having. The one thing that I know as a surgeon hear their story and what they're trying to accomplish, and allowing women to hear of all the options that are available to them. And I do find that Black women many times are, their stories are put on the back burner and they're not given, their stories are put on the back burner and they're not given options. If we look at the rate of hysterectomy, you'll see that more than ever, Black women are usually only given that option. And so, I feel that it's my responsibility as a physician and as a Black female to be able to bring this to the platform and speak in public when it's needed, and collaborating with many of you here who are on this panel, who I have been on panels and sessions and research. And Dr. Marsh knows we've sat on so many committees and boards in order to bring awareness to our communities. And thank you for the patients for sharing their stories, for organizations, patient advocacy. The White Dress Project is on here representing Fibroid Foundation. These are the organizations that are going to continue the messaging into our communities so that we can educate and so we can continue these conversations. This is an economic burden. This is a public health issue, and we need to treat it as such. And the way that we're going to do it is through our collective voices and all of our expertise. And so I hope that through tonight, we can use this education to bring to the community, but also be aware in how we can decrease that time from having symptoms to diagnosis to what surgical or medical options can be offered for you, because that's where people like Dr. Marsh and Dr. Villanueva, we want to meet patients early on in the process. We want patients to come and talk to us early on, so that we're not only having, a few options. So I think everything that everyone has said has really covered everything that we want to know, stories that we've heard. And I hope that the takeaway would be that we are going to push for legislation for us to be able to use a bill and the rights for us to be able to demand the care that is needed for our Black women. And I hope that we can all use our power from what we've learned today, and then collectively getting people's emails from this, asking more questions so that we can do some really, really good work.
Thank you, Dr. Shepherd. I'm so glad we got to hear from you, because you're seeing this every day, and you're seeing tumors much larger than they need to be. So thank you. And now it's my pleasure to introduce our last speaker, certainly not our least by any stretch, Cynthia Bailey. Cynthia is the founder of the White Dress Project, you just heard Dr. Shepherd mention, and whose organizational mission is to raise awareness about uterine fibroids through education, creating community, research, and advocacy. The White Dress Project advocates for research funding and highlights reproductive health inequities, and educates women and providers, most importantly, on fibroids and treatment options so women don't suffer in silence. Cynthia, I'll turn it over to you.
Thank you, Linda, so much. It is such a pleasure to be here this evening. I have enjoyed every moment, hearing from fellow patient advocates, hearing from our researchers, hearing from our doctors. As Linda mentioned, I'm Cynthia Bailey, founder of the White Dress Project. We are a patient-led advocacy organization that provides support, education, and hope for those living with uterine fibroids. Our patient community is our North Star and guiding force as we work to create an environment where their health concerns are believed, all their options are accessible, and where community research, policy, advocacy, and science intersect. We are so proud to support Congresswoman Clark on the introduction of the Stephanie Tubbs Jones Uterine Fibroid Research and Education Act of 2021. This legislation is a critical first step for improving research into uterine fibroids, for ensuring that the research dollars and public education funding match the scope of the crisis. This legislation is paramount, and it acknowledges the many stories, even ones we've heard today, of women from many diverse backgrounds who have shared their stories or even suffered in silence. It is important to point out that 80% of Black women, as you heard Dr. Marsh talk about, will be diagnosed with uterine fibroids by the age of 50. We can't turn away from the reality that Black women bear an undue burden and are disproportionately impacted by uterine fibroids. So we are so grateful to the Congressional Caucus on Black Women and Girls for continuously leading the charge in finding policy solutions to urgent health disparities and public health crises like uterine fibroids. Every single day, we hear from members of our community who are burdened by the symptoms of fibroids. They're dealing with the daily life-altering impacts. They're not getting adequate answers from their physician, and they're searching for hope in spite of limited options for treatment. That is no longer with this bill. I started the White Dress Project in 2014 in the midst of looking for answers and support of my own. I was in recovery from my first fibroid surgery when I looked in my closet and I realized I didn't have any white clothing. And I know that may seem simple, but many women with uterine fibroids identified with this immediately. I didn't own any white because I knew better than to set myself up for a possibly an embarrassing moment in public. The heavy bleeding, the pain, the bloating, the frequent urination. The White Dress Project came to be out of a desire to show up for people suffering with uterine fibroids, to be a source of support, to be a source of information, to be a reminder to people battling everywhere that they are not alone. Now more than ever, we need members of Congress to follow the lead of Congresswoman Clark, Congresswoman Robin Kelly, and Congresswoman Bonnie Watson Coleman, and show up for those who are suffering from uterine fibroids. Make this important research funding a reality. There are far too many questions and not enough answers surrounding fibroids. The actions of our Congress members can turn that around. More research can turn that around. As patients living with uterine fibroids, it's time for us to show up as well. It's time for us to speak up and contact our representatives and ask them that they support this important legislation. How can you do so? Call or write your member of Congress, letting them know how critical this legislation is and that you are asking for their support. Share your story with members of Congress, friends, stakeholders, whomever will listen. Sharing our stories allows us to keep the momentum going and the work of our Congress members to continue. And last but not least, support causes that support this issue. You can visit thewhitedressproject.org to join the movement and be empowered to become your own best health advocate. We must continue to tell stories. For many of us who have become accustomed to suffering in silence or taught that fibroids aren't to be discussed, it might feel scary, but we can do it. Our stories, our voices, our experiences matter. Please join this fight to transform uterine fibroid awareness into action. Thank you so much, Congresswoman Clark, for the opportunity to speak today.
Thank you, Tanika, so much, and thank you for that call to action. And I want to thank all of our speakers tonight for your time, your expertise to help raise awareness of uterine fibroid tumors and the need for research. Thank you to all of our listeners for joining us as well. What we've heard this evening has been extremely informative and shows, I hope, that the disparities that exist are not necessary, and hopefully highlights the urgency of the Stephanie Tubbs Jones Uterine Fibroid Research and Education Act of 2021. Thank you again to Congresswomen Yvette Clarke, Robin Kelly, and Bonnie Watson Coleman for your leadership. This, like any successful effort, has been a collaboration, and so I'd like to thank the White Dress Project, Society for Women's Health Research, the Fibroid Foundation, AbbVie, Hologic, and Care About Fibroids. And I'd like to offer a special thanks to Christopher Cox of Congresswoman Yvette Clarke's office, who's been superb at shepherding the introduction of this legislation. The Black Women's Health Imperative will continue to support this legislation and other legislation that ensures the health and wellness of the nation's 21 million women and girls. This is really important that this legislation passes this year. Now I'd like to turn the screen back over to Congresswoman Clarke for her closing remarks and to end tonight's event. Congresswoman Clarke. Muted. We can't hear you, Congresswoman Clarke.
We all get caught out there, don't we?
All the time.
Well, let me just take this moment to thank you, Linda, for guiding us through today's program with such exquisiteness. Your work in the space, as I stated earlier, the Black Women's Health Imperative has really helped to undergird the policy making that we do in Washington, state legislatures and municipalities across this nation. So thank you for your passion for the health of Black women. I'd like to also thank our wonderful, knowledgeable, expert panelists that were before us today. Your words and your work continue to do what is instrumental in helping us raise awareness around uterine fibroids. You know, my journey to Washington, D.C. was accompanied by uterine fibroids. I was sworn in to the House of Representatives carrying multiple. As they said, the individual, I had over 34 fibroids that I was carrying, varying sizes. And so you can imagine what my quality of life was diminished to. However, you know, I understand why it's important that we have these conversations. If a woman can run for Congress, get elected, show up and get sworn in, carrying 37 fibroids, I know that my neighbors, my friends, my sisters are struggling each and every day, raising families and a whole host of other activities where their ultimate participation is being dampened by maybe the pain, maybe the anguish, the anxiety of carrying uterine fibroids. So what we're doing with this legislation will not only accrue to the benefit of this generation, but future generations to come. So my charge to everyone who is listening is to spread the word. Use your voice to share your stories and make people aware of our experiences. I also would ask that you reach out to your member of Congress to support H.R. 2007, the Stephanie Tubbs Jones Uterine Fibroid Education and Research Act of 2021. I'd like to thank my co-leads on this legislation, Congresswoman Robin Kelly, Congresswoman Bonnie Watson Coleman, and Congressman David Scott. And if any of you have any additional questions about this legislation, please feel free to reach out to my office. As I close, I'd like to once again thank the Black Women's Health Imperative and Linda Gola-Blount for hosting today's event, along with the White Dress Project and our sister Tanika Gray Valbron, the Society for Women's Health Research, the Fibroid Foundation, and Sateria Venable, and the Focus on Fibroid Coalition, composed of many of your organizations. I want to thank all of our expert witnesses, testimonials, and for providing your insights today. And then finally, thank you all for your time. I want everyone to stay safe, stay healthy, stay strong, stay blessed, and no matter what, continue to wear your mask. Thank you for being with us.